Good evening and welcome to Cincinnati Preschool Promise Preschool Chat. Yay! I'm so glad to be here this evening as we return for the season. We're here to inform you all about the no's and the do's and the do's and the don'ts, everything that you want to know with regards to how to either get our children enrolled in preschool, how to keep them safe during the process of preschool years, whatever it may be. Preschool Chat, we're here for you. And so tonight, we have the pleasure of speaking with Dr. Alexandra Sims from Children's Hospital. And she's going to be speaking with us about our children's safety with regards to the COVID-19 vaccination. So hello, Dr. Sims. How are you this evening?
I'm doing lovely. How are you?
I am doing well. I am just excited and interested in what you have to say because as I've shared before with people, I am a doting grandmother of 7. And so we have some younger grandchildren. We have a set of twin boys and they are 4. And we also have a grandson that's getting ready to go on 5 years old of age. And so we're concerned with regards to the COVID-19 still being very prominent and still being much still just a kind of, it seems like alive and kicking. And so, when we start talking about our children, what we know with kids is that unfortunately they attract germs.
Yes.
Yeah, I mean, they're like little magnets for germs.
They do. It's one of the things they do quite well is attract and pass germs.
Yes. And so I wanted to bring you on because I wanted to talk about the vaccination with regards to our children, because I know a lot of parents are concerned. As a grandmother, I'm concerned. Should we get our children vaccinated? What should be the conditions in which we get our children vaccinated? What should we look for? What kind of vaccination should we get them? Is that different from what we as adults currently have already been getting? So I just have a bunch of questions for you this evening.
Well, I'm excited. I'm excited to share. I'm excited to hopefully answer questions and kind of figure some of this out together.
Well, with that being said, let's chat.
Okay,
So,
let's get.
all right. So tell me the ins and out of vaccination, vaccinations with regards to children. When do we think that may be opening up and available to children to become vaccinated?
So I have really good news is that for children that are 5 and up, that time is now. So the vaccines have been deemed to be safe for children 5 and up. And so for us in the pediatric community, that was like music to our ears. I think at every stage of the pandemic, as the vaccinations have opened to more and more groups of children, we have almost cried tears of joy because I think that makes us feel like having the vaccination as an option for children feels like we're able to keep them safe from a pandemic that's been quite scary. I can tell you a little bit about me. I'm, as you said, a pediatrician at Cincinnati Children's. I clinically work in primary care, so I'm the kind of doctor that moms and dads might see when they take their kid for a checkup or when their kid has a fever. I'm the person that you see in the PPC clinic. And so a lot of this is what I'm talking to parents about day in and day out. A lot of the questions that you've already posed. I don't yet have children myself, but I consider the patients, the boys and girls that I see in clinic, some good practice and good experience. I'm getting married in May, or in March rather, so that might be changing pretty soon for me. But
okay, congratulations.
Thank you. Yeah. So I tell parents in clinic, I don't recommend anything that I wouldn't recommend for, my own future children or I have some little cousins, I wouldn't give parents advice that I wouldn't give to my very own family. So I really love primary care because a lot of it is about keeping kids healthy and keeping kids safe. And I think that'll be a good portion of what we talk about tonight.
Okay, and so I'm very excited as well to hear children 5 and up can
Yep.
now become vaccinated. And so I want to talk about that. And later on, we'll dip into our children under 5.
Yes.
But right now, for children who are 5 and up, because for us, that's that end of preschool going into kindergarten. What are the premises around getting our children vaccinated within that age range?
So thankfully, the premises are kind of simple and straightforward, unless a child has a true allergy to one of the components in the vaccines. And by allergy, we mean, they have had a reaction where they are having a hard time breathing, where they've needed like an EpiPen administered. Unless a kid, and that's a very rare scenario, unless a child has a condition, like I said, that is a true severe allergy to a vaccine component, they're eligible for the vaccine. And we are strongly encouraging all children 5 and up to be vaccinated. And so we're not in a situation where a child has to have, a certain disease or a certain disorder or be kind of in a certain group in order to get vaccinated. Really, all children 5 and up, except for, a very small handful of children with severe allergies to one of the ingredients, should and can be vaccinated now, which is really exciting. As you said, I think the 5 and up age group may apply to some parents that have kids in preschool or kids that are transitioning into kindergarten. The studies for the vaccines are happening in children as young as 6 months. And so we think that kind of where this is headed is that eventually, and it's hard to say how quickly that would be, but eventually children as young as 6 months could become vaccinated. We're just not there quite yet.
Okay. And so when we talk about the vaccination, when we speak about it with regards to adults, we know there are 3 different types of
Yes.
vaccinations that have been administered to adults. Is that the same with children?
I think I should have prefaced all of this with the content that we'll talk about tonight is kind of as where we are right now on November 17th. As folks have noticed with watching the news or watching their Twitter feed, things are moving very fast with the pandemic and with the vaccines. And so the information we talk about tonight might, even next week, might be different. But as of where we are right now, the Pfizer, as you mentioned, there are a couple different types of vaccines. Right now, the Pfizer vaccine is what children as young as 5 are eligible for. And so myself, I got the Moderna vaccine. My first dose was in December, and that was the first vaccine that was available to me. And so I was trying to be the first person in line to get it. Moderna right now does not have its vaccine is not available for young children, just the Pfizer vaccine is. The good news is that the Moderna and the Pfizer vaccine have way more in common than what they are different. And so I think in a lot of ways, it's kind of like they're just kind of like different brand names, but they function similarly. They're both mRNA vaccines. And so right now, a mom or dad who has a kid that's, 5 or 6, it would be the Pfizer vaccine that their child would be getting.
Okay. And so then my next question becomes, as a mom and as a grandma, we've been going through this pandemic. However, we have not really heard a lot about numbers with regards to children being exposed to COVID-19.
Mm-hmm.
And so in my mind, it's kind of like a lot of the parents may be like, well, I don't really have a need to get my child vaccinated because the numbers of children that have been affected haven't really been great. Can you talk to us a little bit about the number of children that have been affected? Have we seen a lot of cases of children?
We have, and I think that at the beginning of the pandemic, there was almost this like messaging or kind of commentary that children were not being impacted by the pandemic.
It was.
That's
what I'm saying. Yeah, it definitely was, which is why I was asking, because it was kind of like all you heard about was adults. You never heard anything about children. And so that kind of led everybody to believe that the children maybe had some type of golden touch over them because they didn't get COVID.
Sure. I think that some of that might have been a little bit misleading, to be honest. I think certainly the majority of people that we, you know, unfortunately know that have passed away from COVID, the majority of the people that are ending up in the hospital from COVID are adults. I think that is true. However,
Mhm.
children are not being completely spared by the pandemic either. I think that that difference between adults and children in some ways is what we already know, is that in general, children tend to be a little bit more healthy than adults.
A little bit more resilient.
And a bit more resilient as well. However, what we're finding is that children are still being impacted by the pandemic and by COVID-19, are still getting infected with the virus. And unfortunately, hundreds of children have died. So I think, as a parent is trying to weigh the pros and cons, I think on the pro side, we have a vaccine that is very, very safe, that has been very well studied and deemed to be very safe, and does a really good job of preventing, COVID-19 infection, hospitalization, and death. I think if I were a parent and was thinking about the pros and cons, though it may, compared to maybe an adult, though it may be a bit more rare for a child to die, is that the risk that you want to run with your own child when we have a vaccine that is safe and available and accessible for folks? I know for me myself, it's not a risk that I would want to run. The other thing that we are still trying to figure out is folks might have heard of long COVID, or like some of the longer term effects of COVID. And we still don't yet quite know that because we're still so early in the pandemic. And so the jury is still out on what it is going to mean for folks, for example, adults and children alike, who have had COVID-19, what that means 5 years from now, what that means 10 years from now. I was just recently got my booster vaccine, which we can talk about in a bit if you're interested. But my reason for getting my booster right away as a healthcare worker was because I was like, I don't even want a mild COVID infection because I don't know what that's going to mean in 5 or 10 years. This is a nasty, nasty virus that unfortunately has kind of turned all of our worlds upside down in some sort of way. And so I think protecting ourselves and protecting our children, not only for the right now, but also in thinking about the long term, because we're still trying to figure out what that's all going to mean.
Yeah, Dr. Sims, I can't even imagine it, a child going through COVID. So my husband had COVID and he was on a ventilator for 38 days. And he was in the hospital for 65. And so we have some side effects. We have fibrous lungs, which they said eventually will probably develop into COPD. And we have some neuropathy in the leg because he was in the coma and everything they had to say. So I can't even imagine, and nor do I want to imagine a child going through that.
Sure.
But at the same time, there are still parents out here who are disbelievers of vaccinations, just vaccinations in general.
Sure.
And so I guess, what would you say to them in regards to the studies? And especially, let's just be open and front, in the African American community, because so many things have been with regards to health. We've been kind of at the bottom of the barrel, and we've been experimenting with, and so now we're talking about our children. So at the same time, it's like we want to keep them safe, but we want to keep them safe. And so we don't know which one is the lesser of the two evils. So as a pediatrician, what would you say to a mom?
Yeah. So, it's a conversation that I have all the time about vaccine safety, and, trying to walk with a parent in making whatever the decision they determine is best for their child. And it's not easy. If I can be frank, why I do this job is because of kind of the tortured history that you talked about. The reason that this job is, kind of what gets me out of bed every day.
Yeah.
Because I know that medicine and every other every other profession under the sun has not done well by Black people and Black children as well in history, and I am seeking to kind of be part of the change that helps to kind of turn that tide in whatever little way I'm able to. And so that fear, that distrust is real, and I think
Yeah.
it's something to take very seriously, and as a part of my job that I take very seriously. Vaccine, as a pediatrician, vaccines are something that I feel super duper strongly about. Moms and dads at home, if you take a look at your child's vaccine record that you probably got at their last checkup, every vaccine that's on that kind of vaccine history represents a pandemic in time, represents a point in time in which some other generation was going through, similar to what we're going through now with COVID, was going through a pandemic or an epidemic with a new virus or a new disease.
Dr. Sims, that is such a great point, because it's really hard for me to sit here and picture the chicken pox as a pandemic. But I guess at one point in time, as you just said, it was a pandemic.
And I think I tell families in clinic, if your grandparents are still alive, or if you're blessed enough to still have great grandparents alive, ask them about polio, ask them about whooping cough.
Yeah.
And they probably lost classmates, neighbors to some of those illnesses. Today, we don't really see polio anymore because we've done a really wonderful job of vaccinating people against polio, or we don't see smallpox anymore. Or even, as you just said, when I was a kid, I had chickenpox. I think I was like 3 or 4.
Yeah.
We don't even see really chickenpox anymore because we've done a wonderful job of vaccinating people against chickenpox. Now, obviously, I still lived from chickenpox because I'm still here, but my parents still talk about it now. I was miserable. Even now, I still have scars.
Well, I mean, there were some things. So my mom, she was an older mom,
yeah,
and so she's no longer with us. But I remember mumps was a very big thing, because you would get swollen here and it was an issue, and you would close up and you couldn't breathe and everything and stuff. And so it was a very big issue. And like you said, you don't hear about mumps anymore, measles,
Yep. And so I encourage families to kind of think about vaccines from that standpoint of, yes, in 2021, and we can kind of like not talk about COVID for a second, but in 2021, we happen to live in a time where we're lucky enough, thanks to science, thanks to vaccines, that so many of the things that we just talked about, mumps, measles, whooping cough, tetanus, so many of these things are not a part of our day-to-day reality because we've done such a great job of vaccinating people. And it's almost as if like the fear of some of those illnesses has almost kind of subsided, again, because we're not in the same spot that maybe our grandparents were, where like the neighbor down the street got polio, and you see that person going from being, a happy, school age kid to being hospitalized and very ill.
So many other things too. I mean, just regards, and like you said, venturing away from COVID for a little bit, but just talking about children and health in general. I remember my mom, and I was kind of like, what's that? She always talked about rickets.
Yep.
And, which came from a lack of vitamin D and everything. Right. But that was a big thing back then and stuff for kids to get rickets. And so, all of that. But I think people kind of forget that history when we start talking about our children and health.
Yeah. And I think with so many things, right, we have to continue to forge forward, but we can't forget our history. We can't forget kind of the lessons that generations past were supposed to learn, right? Because we stand to benefit from being reflective on some of that history. And so I think, to fast forward to now, I think for parents that are feeling vaccine hesitant, I can say that I get it. I think as a doctor, as a person who is, both a doctor and also a Black person, and also a person who tries to learn about history and tries to be reflective about kind of missteps in history, I certainly get it. I think that for where we are in science with vaccines, I'll say, none of the vaccines that are out right now are understudied, are unsafe, are and I think the other thing to implore too is that as a physician, I am not benefiting, from a personal standpoint, from a parent choosing to get their child
Mhm.
vaccinated. So as pediatricians, we are, I think, purely trying to do right by keeping kids healthy and kids safe. We don't get more money in our paycheck by kids getting vaccinated or anything like that. There's no incentive outside of
Right. No
just
bonus program.
no bonus program. I think we just want kids to be healthy and stay healthy. And I think part of why so many of us do this job is because in general, kids are healthy and we want to keep them that way. During my training, I did my training in Washington, D.C. I'm from Virginia, and I did my training not too far from home. When I was doing a rotation in the intensive care unit, a little girl who was 2 or 3 came into the hospital, previously healthy, completely fine, running around like every other 2.5-year-old. Her father was a firefighter. I think her mom was a stay-at-home mom, and came into the hospital with meningitis, which is an infection of the brain, fluid around the brain. So went from being, and I don't say this story to scare anybody, but that this was a thing that I kind of experienced secondhand, but went from being happy, healthy, bouncing around, acting crazy, driving her parents crazy, to came into the hospital with full-blown meningitis, was completely unresponsive, and long story short, died in the hospital from a vaccine preventable illness.
Yeah, we actually had that happen at my church. Our 17-year-old years ago Oregon player um, got meningitis and he ended up passing away.
Right.
He was perfectly fine, everything was great, and then he developed a headache, and headache kept getting worse and worse, and they took him to the hospital, and he had meningitis, and he ended up passing away from it. And so, because I think too, the other issue in just talking about vaccinations in general, what I'm noticing is a lot of parents nowadays miss the vaccination schedule.
Sure.
And so it seems to be, instead of keeping on schedule or routine schedule, it's kind of doing sporadic with some kids to say, okay, get a shot here, and when we go back here. Or the other thing that I noticed, um, just taking my grandchildren to the doctor and everything, a lot of parents have to, hospitals have to play catch up. So when
Sure.
they have them there, they have to try to get the vaccine there because they might not come back for that appointment again.
Sure.
Yeah.
That's definitely something that we see. I mean, I think the pandemic has certainly created challenges for people, either, again, people's lives being turned upside down and not being able to get to the pediatrician, or especially earlier in the pandemic, I think rightly so, folks were prioritizing like, look, we're just going to stay at home and we'll get to the pediatrician when we can get to the pediatrician. I was having a conversation with a mom about that today, and she was like, I know we're behind. I know we have some catching up to do, but when COVID was worse, we just didn't want to leave home. And I think, that totally makes sense of kind of prioritizing safety and just hunkering down at home.
And let me ask real quick. So with that being said, how hard is it to get an appointment to get children in for vaccinations? And this is a 2-part question. What does that look like? Because right now I can go to CVS, I can go to Walgreens. There are a lot of places I can just drop off and say, hey, I need a vaccination. And can our children do the same thing?
So, I can only speak for the place that I work, at Children's right now. It's a super busy clinic, and we're happy to take more, happy to see more people if it means keeping kids safe and kids healthy. I really encourage, I think part of what I love about my job so much is getting to know kids and families kind of over time. And so if it's feasible for folks, I really encourage to build a relationship with a pediatrician that you can get to know, that you can kind of build that trust with, and ask the hard questions too, right? Like, like, okay, I hear what you're saying, but like, would you do this for your kid? Or like, I hear what you're saying, but is this the same advice you would give, people in your family? I think as you grow comfortable with someone, you can kind of start to really grow trust with them, hopefully, is the goal. So I'd encourage folks, if it's reasonable for their work schedule, school schedule, et cetera, to really try to build a relationship with a pediatric provider over time. Certainly some of the childhood immunizations are offered, as you said, at like a CVS, a Walgreens, et cetera. I think the challenge there is that kind of, will they know the other vaccines that child has received and kind of what they're due for next? Because it can get a little bit complicated. But certainly, again, like wherever someone is able to get vaccinated is a good place to get vaccinated. And I think any time is a good time to get vaccinated. So I was in clinic today and was seeing a child for something completely different, but they were a bit behind on their vaccines. The family did not, vaccines were not a reason that they came in for the visit. But when, I broached, hey, I noticed, this was actually the mom that was like, I know we're behind because we didn't come in during COVID. And I said, today is a perfect day to kind of start to get caught up on some of the vaccines. And we kind of came up with a plan of what that could look like. There's no, from a like scientific standpoint and in the studies, there's no like maximum amount of vaccines that are like too much or that are like unsafe to give together.
Okay, that's good to know.
Yeah, sometimes parents express like, oh, like I don't want to give too many vaccines at once. There scientifically really is no too many. Me, myself personally, once we start to get to like 6 or 7 vaccines is when I start to feel maybe a little cruel. And so that's kind of my, again, like personal threshold of like, all right, if they're due for like 8 vaccines, we can do like 5 or 6 today and bring you back another time to do more. Also now during COVID, some folks might be wondering, but it is safe to give both the COVID vaccine and the flu vaccine together. And that's something that we've been doing, not only because it's convenient and saves you from having to come back for another visit, but it's also safe to do both together, safe and effective.
And that's funny because that was one of my questions to you, and because I was going to ask you how. So we talked about children getting the COVID vaccination, but how do you feel about children getting the flu vaccination?
Yeah, I think my opinions are basically the same. I think could you kind of roll your dice and decide to chance it and, have never gotten the flu before. So, kind of willing to run the risk. Certainly. I've only had the flu once in my life, and I, no lie, felt like I was going to die. It was awful. I have never had a fever as an adult until that time. And even just having a fever feels pretty awful.
I personally think that it's the worst to have a fever as an adult.
Oh
fever as an adult feels totally different than fever when you're a child.
Well, part of me said, I felt like I had so much more empathy for my patients who come in with fevers. Like, okay, that's why they're so grouchy and kind of crying and feeling upset, because it feels awful to have a fever. So even just to save from not feeling those feelings again, I get my flu shot every single year religiously, because it just doesn't feel good to be sick. Aside from the fact that, kind of as we've alluded to already, people get hospitalized from the flu every year. People die from the flu every year. Is it as many people as COVID? Certainly not. But do I want to roll those dice,
right,
for myself or for my future children? Absolutely not. So I think in my mind, if things are preventable and if the things that are going to prevent us from getting them are both safe and effective, for me, it's worth it to go the route of prevention. I feel like that there's an old saying, an ounce of prevention is worth a pound of cure, or something like that. But kind of putting your eggs in the basket of prevention for me is far better than trying to make up for kind of getting over an illness, if you will.
Yeah, yeah.
People
So I
sometimes
know
ask,
you had some
oh, sorry.
slides. Would you
Yeah,
like to share your slides and stuff now?
we can certainly go into the slides. I feel like we've covered a lot of the content already. I was
I
going to
told you I had a
say,
lot of questions.
I love it. Yeah. I was going to say, because folks might be wondering, just because we've started to talk about both flu and COVID, and I feel like this is a commonality between those vaccines. Folks have asked me, you know, my mom, dad, uncle, cousin, after they got their flu or COVID vaccine, either one, didn't feel well after. So, you know, what does that mean if someone had a fever after a vaccine, if they felt achy after a vaccine? So, and I'll get into it, I guess, when we talk about the slides, but when we think about how vaccines work, they basically trick our body into developing protection against the illness without having to endure the process of getting the illness in the first place. And so
With our
both,
memory cells, correct?
exactly, and both the COVID vaccine and the flu vaccine do that. Your body basically, once the vaccine gets in there, your body says, oh, what's that? I don't recognize that. I'm going to build some protection against that. And the very same protection against the vaccine will also protect you against the illness. Neither vaccine gives you the illness, like it's not possible to get COVID from the COVID vaccine and from the inactivated flu vaccine, which is most of the flu vaccine that is out there. It's not possible to get the flu from the vaccine, and the kind of like feeling of feeling unwell that people experience, which I had after my COVID vaccine, even after the flu shot I had as well, is really your immune system kind of building up that defense. So if anything, it sounds kind of silly, but if anything, you can kind of look at that response, that fever, that achiness after the vaccine, you can kind of look at it as a good thing.
Yeah, I was just getting ready to say. So I always was told that a fever and things of those natures are actually positive feedback of the body.
Yep.
And so you kind of help because it's been a minute. I don't want to tell my age, but it's been a minute. So those are positive feedbacks of the body. And so most viruses that we encounter, if our body has already encountered those viruses, then you'll get no response because your memory cells should kick in. But if there is a virus that you are just exposed to and are new, that's when your white blood cell count or your white blood cells will go into action and you'll receive a fever and, you know, the chills and all like that, because that's the positive feedback of your body saying something new is entering.
Exactly.
Right?
Yeah, exactly.
Okay.
And so I think, you know, if someone, like the vast majority of people have a very sore arm, even that is like, as you said, that immune system, those white blood cells firing up saying, okay, we got to prepare ourselves. We've never seen this before. So you can kind of, you know, when I got mine, I was laying in bed, you know, I had a little fever, didn't feel good, but I was like, okay, this is a good thing. This means my body's doing what it's supposed to do. It's almost like, you know, we have an alarm system on our house. And if you know, when we set the alarm when we leave, when we come in the house, if we forget to deactivate the alarm starts going off. And that's a reminder of like, oh yeah, we have an alarm system. It works. And you can kind of think of the immune response after the vaccine as the same thing. I have
your body alarm system.
Exactly. And it's reminding you that it works. It just, you know, doesn't feel great, but it's pretty short-lived. And it's certainly, as you know, from your personal experience, way shorter lived than having a true infection.
Right. And so I want to go back to one thing that you said, because I think a lot of people misunderstand this. You said something very important. You said inactive.
Correct.
And so a lot of people, because I asked about both of them, that the COVID is not active, but a lot of people tend to think that the flu virus or the flu vaccination that they give you, that they use a live virus versus using a dead virus like they're supposed to do in the polio and everything.
Correct. Yeah. The flu vaccine that you get in your arm is a dead virus. So it's not a live virus. It's not scientifically, it's not possible to get the flu from the vaccine. The mechanism just isn't there. Certainly no vaccine is perfect. And so it is still possible with any vaccine to still end up with the illness. Again, those chances are going to be severely diminished, and the odds are going to be quite lower. And for the flu vaccine, for flu and COVID, folks that have gotten vaccinated and the few folks that still end up with the infection get a much milder illness, are much less likely to be hospitalized. And so getting the vaccination still has a benefit, even if you're kind of one of the few people that still ends up with what we call like breakthrough infection.
Okay. Okay.
Does that make
Thank
sense?
you for, yes, thank you for clarifying.
Sure, certainly.
All right, ready for your
Yeah,
screen?
I'll dive into these slides, and I'll kind of skip through anything that we've talked about already. Are you able to see the screen with the PowerPoint?
I am.
Okay, I'm not going to put it in presenter mode just because I feel like that can oftentimes cause problems. So I'll keep it like this. So these were the things that I was hoping to just kind of breeze through today. And like I said, so much of this content we've talked about already. I'm hoping that folks can kind of think about how this content tonight, one, applies to them themselves, because I think there will be some content here that will make you think about perhaps your own vaccination status and your own questions and concerns. Certainly because we're talking about kids and preschoolers, and maybe other kids that you have at home, thinking about how this impacts your family and your friends. And then also broadly speaking, how all of this is impacting our community. I think some of the challenges, right, during this pandemic is that it's forced us to think outside of ourselves. And I'd encourage you to kind of continue to do that. Not only how is this impacting me and my household, but also what is my part in this as far as like to my fellow, my neighbor, my coworker, my person on the bus that I might not even know. So hopefully we can be community minded. I was going to give you some quick background just about the COVID-19 virus. COVID-19 is a disease that's caused by a novel coronavirus discovered in 2019. That's where the 19 comes from. Coronaviruses are a group of viruses that have long been in existence, but you can kind of think of the COVID-19 virus as like a new type of coronavirus that kind of sprouted up and emerged. This is a common thing that viruses do. They constantly mutate. It's like their way of surviving and staying alive, is that they change parts of themselves and can end up creating, fully new strains of things just by trying to keep themselves alive. COVID-19 is spread via droplets and small particles that are kind of expelled from us when we sneeze, we talk, we cough. And you can imagine that the interventions that we've come up with so far, masks most importantly, prevent that transmission. You've likely heard about respiratory symptoms or symptoms involving the breathing system. And as you've said, Ms. Florence, require folks to be on ventilators to support their breathing. But this virus has been, I described it earlier as quite nasty because it affects multiple organ systems in the body. So it's not only isolated to the lungs and the breathing system, but can impact basically every organ system in the body. In the US, over 760,000 people have died since the beginning of the pandemic. I think sometimes these big numbers, it can almost be harder to think about what that actually means. And so I did the math, and that would equate to the loss that we experienced from 9/11, September 11th, that loss every 2 to 3 days over the past 18 or 20 months or so. So we can think about like the sorrow that we felt on 9/11, and, probably a lot of us know somebody that was impacted by 9/11. I was in the DC area at the time. I was in high school, and had a classmate that had an uncle die in 9/11. And we can think about that happening every 2 to 3 days. I mean, that amount of loss is, it's hard to even measure or imagine. So I'd encourage you to kind of think about those numbers. We're experiencing high community spread almost in every community. This map is from the last time that I gave this talk, which was back in September. And you can see the red dots represent high community spread. And then this map is to where we are today. I took a screenshot right before we started. And you can see that things are starting to move closer to less spread. And that is certainly encouraging. And we have vaccines to thank for why some of this change has happened. So I'll toggle again, just in case you didn't catch that. This is where we were with community spread in September, which was basically high community spread everywhere. And it looks like we're starting to make some progress thanks to vaccines. I wanted to give a quick nod to variants, because this might have been a thing that folks have heard about in the news or in some of their own circles. As I said at the beginning, part of how viruses survive is that they mutate. And so they change. I'm actually going to go back to this slide real quick. They change parts of themselves, including some of the proteins that exist on their surface to keep themselves alive. This will come back to the structure of the vaccine. And I don't want to get too scientific, but it becomes really important when we think about how the vaccines work. If you were to look under a microscope, the COVID-19 virus looks just like this. It's a circle, like a spherical ball, and it has all these little things like popping out of it. Corona in Latin stands for crown, and so the coronaviruses get their name because the surface of them almost look like a crown with like all those little prongs poking on top. It has lots of different types of proteins in those little prongs. They're named by different letters, S, E, M, and we'll get back to that when we talk about the vaccine. And so the way that viruses keep themselves alive are mutating and changing different parts of themselves. The Delta variant got a lot of attention over the summer and fall months as a new strain of the original COVID-19 virus. So we're still talking about COVID-19, just a kind of different strain of it that was found to cause the same symptoms, but be more contagious, spread faster, and contribute to more hospitalization, more death, and more severe infection. If you were to go get tested for COVID, and if you were to found to be positive, you yourself wouldn't know, like they wouldn't say, you are positive for COVID and you have the Delta variant. But based on the level of Delta variant in the community, safe to say that most of the COVID-19 infection across the country and specifically here in Ohio from summer until now is caused by the Delta variant. This is just meant to show you that the COVID-19 original strain, if one person were to get it, we think that that person would go on to infect about 3 other people. And with the Delta variant, one person is thought to then go on to infect 6 to 7 other people. And you can see how this could quickly become a nightmare, or the current pandemic that we're in, even with this 1-to-3 ratio, right? If I go impact 3 other people and each of those people go impact 3 other people, we're quickly looking at thousands of people before you know it. You can see kind of how that infectivity compares to the 1918 flu. Again, like I said, if you're lucky enough to have a grandparent or a great-grandparent around, you can ask them about some of these pandemics of past times, but not quite as infectious as something like chickenpox, mumps, or measles. But that math can get very scary very fast. As far as vaccines are concerned, we kind of talked about this already, but there are a couple different types of vaccines available here in the United States. The mRNA vaccines are the Pfizer and Moderna vaccines. And outside of the age eligibility, which we've talked about earlier tonight, they basically function the same, and I'll get into some of those details. The Johnson & Johnson vaccine is called a viral vector vaccine. And so it uses kind of the outside core of a separate virus, not the coronavirus, to deliver information to your immune system. Excuse me. Tens of thousands of people have participated in vaccine trials. Actually, Cincinnati Children's is a vaccine trial site. And so lots of people that I know either enrolled themselves in a trial or enrolled their child in a trial, and were able to really positively contribute to science. So something to think about if you haven't done that already. But before these vaccines were made available to the public, they met both safety and effectiveness standards. And that prompted the authorizations that then came. And so they were deemed to be quite safe and quite effective. As I said at the beginning, the medical community really cried tears of joy when we saw the data. Not only do the vaccines work, but they work really, really well. Not only are they safe, but they're very, very safe. And it's kind of the best case scenario that we could ask for, because I feel like I, as a healthcare provider, can provide you a strong, enthusiastic recommendation about this vaccine, not only for yourselves, but for your children right now, 5 and up, and hopefully for your littler kids not too long from now, hopefully. Just like any other vaccine, all of these vaccines are ongoing monitoring and safety and effectiveness standards. So the rare instance of a side effect or an adverse reaction is being monitored and reported. But for the vast majority of people, these have been a godsend, I think is the easiest way to say it. How these vaccines work, I think the easiest way to think about all 3 of them is that they basically work via a Trojan horse strategy. So the picture of the virus that I showed you at the beginning was the circle, and it had all those spokey things coming out of it. Those spokey things are proteins. And so the vaccine, you can think you go to CVS or whatever, you get your shot, that shot goes into your body and has your body generate those spike proteins. And so it's not generating the whole disease. You can't get infected with COVID without that whole sphere and pokey thing process. But what the vaccine does is it has your body start to make some of those spike proteins, and your body says, hey, wait a second, I don't know what this is. I've never seen this before. Let me make some antibodies against this so that if I ever see it again, I'll be ready and prepared. And that situation of if I ever see it again is if your body is exposed to COVID-19 in the future. And so I said at the beginning, but I'll say again, it's not possible to get the COVID-19 virus from the vaccine just based on how the vaccines function. Your immune system is going to recognize those spike proteins as foreign, develop a defense against them, and the vaccines prevent both asymptomatic infection and symptomatic infection, but most importantly, and what we care most about, are serious illness, hospitalization, and death. I said, and I'll say it again, safe and effective for all 3. I will move over that. The vaccines do protect against variants. And so I talked about the Delta variant, and the effectiveness is certainly there against variants. But as I said, viruses are tricky and they like to mutate themselves to remain relevant and remain to survive, basically. And so some of that effectiveness of the vaccines is a little bit lowered with the variants, but still quite a robust and strong response. Breakthrough infections I described at the beginning, those are folks that have gotten vaccinated but still end up with a COVID-19 infection. And that's to some degree to be expected with viral infections. You see the same thing with flu, but the good news is that folks that are getting breakthrough infections, for one thing, it's quite rare, and for 2, are experiencing much more milder infections that they can kind of ride out at home and are not experiencing hospitalization, death, etc. Not all states are reporting on breakthrough infection, and Ohio is one of the ones that are not. But I was going to give you just a quick case study using some California data to hopefully sell home the point of why vaccinations matter. So you can see here, this is data from January to July of this year. California has vaccinated over 20 million people in that time frame. And you can see, of all the COVID-19 cases during that time period, only this tiny sliver, the blue part, is among people that were vaccinated. The vast majority of cases were among unvaccinated people. The same goes for hospitalizations. So you can almost barely see the blue sliver here, and that represents folks that were hospitalized with COVID who were vaccinated. The vast majority of hospitalizations due to COVID were among unvaccinated people. And then for COVID deaths, you can see, I mean, I can basically not make out that blue sliver. The vast majority, almost all, 99.8% of COVID deaths were among the unvaccinated. So the take-home point here is that although we know that vaccines are not perfect, we can see that this is truly a pandemic of the unvaccinated at this point. You might have heard about boosters or additional doses. I'll be quick here, but essentially, this is not an uncommon thing with vaccines. And again, if you were to look at your own child's vaccine record, you'll see the same vaccine repeated multiple times. And what we find is that when a vaccine is created, it is very seldom that it's a one and done thing. It is more typical to need more than one dose of a vaccine, either in a small cluster, such as your child's 2, 4, and 6-month vaccines, for example, or such as what we experience with the flu vaccine and what may be the case with the COVID vaccine, needing to get something annually or semi-annually. So this doesn't mean that the vaccines don't work. If anything, this is kind of an expected response of vaccines. Additional doses are quite common. So I was going to go through some quick myths, and we've kind of talked about some of this stuff already. Stuff that I hear in clinic, talking to moms, dads, and children, and wanting to think about getting vaccinated. I don't want to get the vaccine if it's going to make me sick. We've talked about the fact that the vaccination itself cannot give you the COVID-19 infection, and that the immune response that you experience in some ways is kind of a good thing and tells us that your immune system is doing what it's supposed to. That response is also not an allergy. So that super sore arm or that fatigue, that headache, nausea, fever, all of that stuff is not considered an allergy, but in some ways is a positive response from your immune system. Some folks have asked me, I've already had COVID, so I don't think that I need a vaccine. And you do get some natural immunity from COVID infection, but we think that that only lasts a couple months and is actually not as robust a response as you would get from immunity from a vaccine. So we think that the vaccine will actually do a better job of protecting you in strength and also in duration, so for a longer amount of time than just the natural immunity from an infection. The vaccines were rushed, folks have asked me. Research about coronaviruses and about mRNA vaccines had actually been ongoing for a decade prior to the pandemic. Early in the pandemic, China was able to isolate the genetic code of the virus and then share that, so that researchers were basically able to hit the ground running with developing a vaccine, and no steps were skipped in vaccine development. Folks have asked me about the vaccines changing your DNA, and we've discussed how they work, but it's simply not the case. The vaccines are delivering information to your immune system and allowing your immune system to respond, but it's not doing anything to change who you are inherently or changing your DNA. You can look at them as kind of priming your immune system or giving your immune system almost like a roadmap for how to fight off COVID. People have asked me questions about whether the vaccines impact fertility. This was unfortunately a rumor that was started on social media. Unfortunately, I personally love social media. I'm on all the platforms, but I think this is one of the downsides of social media, is that misinformation can spread really fast. The spike proteins, the pokey things coming out of the circle of the COVID virus, are unique to the COVID-19 virus. Our body makes spike proteins that look differently and serve other purposes in other parts of our body. So unfortunately, someone who just wasn't informed read, oh, there's spike proteins in the placenta, and decided to make that a reason to not get the COVID vaccine. The spike proteins on the placenta and on other parts of your body look completely different than the spike proteins that are related to the vaccine or the infection. You can kind of almost think about it like you wouldn't be able to get into your car with your house keys, and you can't get into your house with your car keys. And those spike proteins are just that different. They serve completely different purposes. And so the vaccines don't impact fertility or menstrual periods or anything like that. This piece about microchips, magnetism, is simply not true. The vaccine ingredients are readily available online. So if you just Google COVID-19 vaccine CDC ingredients. There's a chart that you can pull up. I'm also happy to pull it up in the remaining minutes that we have. But the vaccines do not have any preservatives. They don't have any latex, no gelatin, no metals, no egg. So it's a short list of ingredients and doesn't have any of the things that people are worried about. I was just going to tell you a couple things about kids, which we've kind of already talked about. Safe and effective and recommended strongly for children 5 and up, and hoping that we can extend those into younger age groups as the studies and the findings continue to be rolled out. Children are impacted by COVID-19 now more so than earlier in the pandemic. Some of that is because now that we're kind of everybody back to school, a lot of that is in person, and children make up a bulk of the unvaccinated population. It was kind of a perfect storm for kids to be unfortunately exposed to a lot of COVID. I would encourage parents to have a plan for testing. So if your kid needs to be tested, make sure that you understand how your pediatrician's office is handling that. And then I always say the best mask for a kid to wear is going to be the mask that they're going to wear all day. So if that happens to be the Paw Patrol mask that they love, make it the Paw Patrol mask. I've actually been blown away by how easily most kids have taken to the masks, and the number of children in clinic that are able to tell me, sometimes better than adults, I wear my mask because I want to keep myself safe and I want to keep other people safe, has really been heartwarming. I want to give a brief nod to some of the stuff that you might have heard about vaccine side effects. The two probably most common things you've heard about are myocarditis with the mRNA vaccines and platelet disorders with the Johnson & Johnson vaccines. The main thing that you need to know with these side effects are that they are quite rare, and that an adult or a child is more likely to experience myocarditis or a platelet problem with the COVID-19 infection. So they are rare, and you're actually more likely to encounter them if you were to get infected with COVID. So kind of brings me back to the point of we should prevent COVID in the first place. Masks are not harmful for kids. They might be annoying. It might get tiresome to kind of keep repeating yourself and reminding your child to have the mask on, but it's not harming them to have the mask on, and it's not impacting their breathing. We also are finding that kids are being impacted by this pandemic. So I think the sooner that we can get out of the pandemic and vaccines are truly our way out, I think the quicker we can all kind of establish a new normal. I don't know that we'll get back to what we knew as normal, but I think finding a new normal will be where we get. I'm hopeful that you can kind of, with the content today, do some reflecting, do some reading, and really make sure that the research that you're doing is informed. My goal, just like your goal, is to keep your kids safe. And so I hope that whatever decisions parents are making are informed decisions, and that you feel good about knowing the pro list and the con list. I think the CDC website is a beautiful place to start. They have things, they must be working truly 24/7, because they're keeping things updated really well, really easy to read, easy to follow, a section basically for everything you could want to know. So that's everything I had. I meant to put my Twitter handle on here, which I'll write real quick. I'm happy to, as questions arise, answer questions either through email or social media, which I said I love, for better or for worse. That's my email, and how to find me on social media.
No, I mean, you had a lot of great information that I believe that our parents needed to know, especially with regards to children and vaccinations and keeping them safe. And that's the key important thing right now, that we keep our children safe. And so for me, this was great as we went through everything. I feel more informed with regards to keeping the baby safe. As you said, we're not at their age yet. We're at 5, but hopefully soon we'll be moving towards under 5. And so then when that happens, hopefully maybe we can have you come back. I know next month where you and you're going to be joining me again, and we're going to be talking about part two of how to keep our kids safe, just with regards to everyday finding of the house, because sometimes the house can be a little bit more dangerous than what parents realize. I know
Correct.
the twins, they get into a little bit of everything. So I'm really excited. Everybody, please join us next month as we talk to Dr. Alexander Sims again with regards to how to keep our children safe, part two. This has been a wonderful chat this evening. I look forward to seeing you guys next month. Thank you, everyone, for attending Preschool Chat.
Thank you all. See you next month.